Okay, let's talk a little bit about healthcare. Is healthcare a right or is it a privilege?
I think it's a right.
I think it needs to be a right.
I believe it needs to be a right as well.
In a utopian society, absolutely. Everyone should have everything. But this is not. It's reality. And, you know, I actually have some very strong feelings on, you know, a single payer system. My husband works for a pharmaceutical company. It would be devastating to our family if we went to a single payer. My husband also had cancer last year. After he went through chemo, he went through another treatment that boosted his immune system. But he was on like a Facebook support group, and he saw other people from Australia, from the UK, not able to receive that treatment. They weren't approved for it.
Jessica?
Fundamentally, I believe it is a privilege, but one we should absolutely be working towards ensuring everybody can access. You know, for example, I don't have health insurance, and I never have. My family's never been able to afford it. So I think, and it's actually worked for us well.
Are you worried that you don't have health insurance? Or is that by choice?
It's by choice currently, but my circumstances will change. And I know that at some point I will need that option.
I just have a question for you. How did you feel about being taxed for not having health insurance under the Affordable Care Act?
I sidestepped the tax by having a Christian health share ministry, which is basically catastrophic.
Oh, yeah.
But that is a point where I don't think you should be forced to have health insurance. But also, if we want people to have health care, where's the funding going to come from? And that's a really difficult question to answer.
You understand the fundamental issue at the heart of it, which is you need healthy people to buy insurance so that sick people can also get medical care, right? It's the catch-22 of the system.
Well, if you ask people with socialized, you know, medicine, like, what do they think of it? They're going to tell you it's not good. They're not happy.
Right. America has some of the best healthcare in the world.
You look at the waiting lists. These people go and they're told that they have to wait like 8+ months for the doctor's visit that they need to see with the specialist or whatever, the mammogram or whatever it is. And at that point, they could be dead because in certain situations with like high risk cancers and things like that, you got to be seen quick. Right. You can't wait that long. Like, people are dying in socialist countries with healthcare.
Do you want to say something?
Yeah, I'd like to just interject because that does happen with socialized medicine when the system is overwhelmed with there's only so many facilities and everyone is counting on them. We have private insurance that my husband pays a portion of through his employer. We have really good insurance and we're really lucky. And I've been waiting 5 weeks to get an MRI approved. I have nerve pain, I'm losing sensation in my body, and I'm a lucky person. So yeah, healthcare is a right. If I couldn't get any kind of healthcare, it could not be able to move the entire right side of my body. So for people to say like, oh, well, it's all about ideals and it's a utopian wish that everyone could get healthcare. Everyone can get healthcare. How do we pay for it is a separate issue. Do we have different levels of if this is income-based? Is it need-based? There's solutions, but I think to say that it's a privilege that even the privileged people can't access when you're the one who's supposed to be so privileged is...
So you're saying even when you do
there's
have
so
healthcare,
much. There's so much that goes beyond like, have the insurance, great. I still can't get any help.